Hi everyone, welcome to today's webinar on glanders in horses. So we have two lovely vets with us today. We have Dr. Shivani and Dr. Alex, and they're going to be tag teaming the presentation today. If you have any questions, please just pop them in the comments section and we will get to them at the end. But I will now hand you over to Dr. Shivani. Thank you.
Hello, I am Dr. Shivani, working as a resident equine veterinarian in WVS India Ooty. I'm currently involved with training outreaches and on ground interventions aimed at improving welfare and equine health in Nilgiris in Ooty. Yeah. Glanders is a contagious, fatal disease of equine having a zoonotic potential. And today, Dr. Alex and me would be talking about about its clinical significance, public health implications in India, and we'll be mainly focusing on the causative agents, science, diagnosis, control strategies, and the government's response under the revised National Action Plan of 2025. Glanders continues to be an important re-emerging zoonosis in India, particularly affecting working equids, that is, horses, donkeys, mules. While the disease has been largely controlled in many countries, periodic outbreaks still occurring in parts of South Asia. In India, glanders surveillance and control involves a collaborative effort between the government and the non-government agencies. WVS India contributes by fieldwork and owner education. WVS plays a significant role in capacity building and in creating awareness among veterinarians and equine owners through education programs and training programs and field outreach camps. Education programs focusing on improving awareness, knowledge among veterinarians as well as owners, and to encourage timely reporting for early detection is like one of the main thing that we deal with. So historically, the disease was widespread across all the regions where the horses were heavily used for various kinds of for various works and reasons. And with improved veterinary control measures, testing policies, culling programs, glanders were successfully eradicated from most parts of Europe, North America, and Australia. Although it still remains endemic primarily in parts of Asia, Middle East, North Africa, South America. This particular map was taken from the Journal of Neglected Tropical Diseases of 2025, and this plots the recent outbreaks in the endemic area. Persistence of the disease in these areas is mostly linked to the large population of equids, movement of animals, shared equipment, and the coexistence of carrier animals among the healthy population. Next slide, please. The disease was historically present in India, where horses and mules were widely used for transportation and military purposes. Uh, Through strict surveillance and control programs, India was declared free of glanders in the early 20th century. However, a re-emergence was observed in 2006 among the working equids, mostly in the northern part of the country, and since then, sporadic cases have continued to occur. Between 2006 and 2023, 1,844 confirmed cases were reported. The outbreak of 2025 hits different, and it is different in the sense that sporadic cases before used to occur among the unorganized sector, and the outbreak in 2025 occurred in the race courses, which is an organized sector. 17 horses were tested positive for glanders, and among those 17, 11 horses were from the Hyderabad race course, 6 from Bangalore, and 1 from Mysore race course. Next. The map shows geographical distribution of glanders outbreak that was reported in India over the recent years, and most of the cases have been concentrated in the north and the northwestern parts of the country, which corresponds to the higher equid population, mainly used for transportation, for brick-kilns, tourism, trading, among the working class. It is important to note that the animal movement between the states plays a very important role in spreading of the disease. The 2024-25 outbreak highlighted the continued risk of the disease spread. The equine industry in India is roughly divided into two sectors: organized sector and the unorganized sector. Next slide, please. The organized sector includes the breed horses like the thoroughbreds, exotic breeds, or the indigenous breeds, which are maintained in a biosecured premises by the armed forces, private or government owned breeding farms and stud farms, race courses, polo clubs, and the pharmaceuticals. And the organized sector has definitive management and surveillance strategies in place, whereas the unorganized sector includes all those equids which are owned by owners who use the animal for their daily for their living, to earn a living out of the animal, and hence it's called working equids. And those animals are mostly used for transportation of goods, transportation of people at pilgrimage sites, for tourist riding, marriages, and for all other stuff that is going to generate a livelihood. And this sector is basically outside of the biosecured premises and lacks the definitive screening and surveillance. The unorganized sector again includes the daily wagers who maintain equid for a living. And because of the unstable financial situation of the owners, any losses that happen in term of animal mean loss in the livelihood, and hence controlling the disease becomes even more important. Next, please. A study was carried out called Knowledge, Awareness, and Perception about Equine Glanders among veterinarians and medical professionals in India, with the aim to assess the level of knowledge, awareness, and perception of glanders among veterinarians and medical professionals. Because of its zoonotic nature and its potential to be used as a bioweapon, understanding how well professionals recognize and respond to it is extremely important. It was found that although many professionals were generally aware, there were still significant knowledge gaps, particularly regarding the clinical recognition, transmission routes, and reporting procedures. A total of 165 respondents from 11 states and one union territory were surveyed, where 40% of people were not aware of the government regulation, 22% people were unaware of the transmission of glanders. And this is a major concern given the widespread occurrence of disease in the country. Analysis of perception towards equine glanders showed that majority of the participants observed that horse owners were reluctant to disclose the clinical symptoms due to fear of losing the animal, economic loss, and lack of awareness of the existing government policies. The study also highlighted the need for education among the veterinarians regarding the existing government policies and guidelines with awareness programs. Also, the zoonotic nature of the disease makes the intersectoral coordination to investigate human glanders really important. Next, I hand over the presentation to Dr. Alex.
Thank you, Dr. Shivani. That's so frightening for those of us that live in countries where glanders isn't anymore seen. And for many vets and many medics, this is something out of the history books, and we're really unfamiliar with the disease. So I'm going to just talk us through what it will look like if you are unlucky enough to see it, and some of the other diseases that could be mistaken for it. So first of all, as Shivani has pointed out, this is a highly contagious and a fatal disease of equines. The bacteria lives mostly in the horse. The bacteria is called Burkholderite malae. It's a gram-negative rod, and it's endemic throughout large parts of Asia and North Africa. And the disease itself is called Burkholderite malae because that's the Latin word for hammer, because the disease used to strike horses with such force, it was felt like it was like a hammer blow and would take out huge numbers of animals very, very quickly. And what was even more frightening is that it would then potentially spread to handlers as well. So we know that it's important from an economic point of view. These animals in the racecourse at the moment are causing huge economic losses to the industry, but also a loss of income to the household where there's a working equines, particularly if animals have to be compulsorily culled, and that will also cause a loss of income. As vets, we're extremely concerned about the welfare implications of this disease. They do become extremely sick, extremely unwell, and just feel really bad, and will have a very unpleasant disease and death if it's allowed to continue. It's also OIE, or WAOH as it's now known, listed, which means there are import and export restrictions on a country that is known to have glanders. Export of equines from that country will not be possible. So if we think about the signs of glanders, I think what you'll notice is that in the initial stages, if you're a field veterinarian, there may be other diseases that spring to mind if you're not familiar with glanders. So one of the first signs is respiratory. So you will have a nasal discharge, a high temperature, a cough, and there will be sort of pus and mucus and potentially blood coming from the nostrils. And these can sort of produce scarring. So you'll get these star-shaped scars within the nostrils, which can go all the way back to the oropharynx, affect the breathing, and the lymph nodes will swell. The ulcers will become enlarged, and the infection can spread throughout the body, leading to enlarged lymph nodes, nodules within the lung, and the disease can also be spread around to the liver, the kidneys, and the spleen. The disease is certainly more serious in donkeys than horses, who will tend to be worse affected. And I think clearly you'll notice that in the early stages, this is going to give a similar presentation to a disease such as flu, or equine herpes, or equine strangles. So it can be quite difficult initially to recognise that this is glanders. The other form that the disease takes, as well as the respiratory form, is a skin form, which has got the colloquial word name of Farsi. And in this disease form, we get the bacteria tracking along the lymphatics, bursting out as ulcerated nodules that produce a kind of golden honey-like pus, and there will be swellings around the sheath, under the abdomen, and around the lesions. These will take between 1 and 5 days to sort of incubate. So again, we've got other diseases that could be confused with this type of presentation, especially in the countries where glanders is endemic. So EZL, epizootic lymphangitis, would be one of the really big confusing diagnostic factors, and that would be due to histoplasma that also tracks along the lymphatics. Strangles in a disseminated form, or skin staphylococci, or even some of the nastier fungal infections, the coccidiomycosis, could potentially be a differential diagnosis for glanders. So the disease itself can cause issues with just the straightforward clinical diagnosis. And I think what can help with our initial disease making is certainly thinking about some of the wider factors. So if I'm in the UK, this is really unlikely. If I see a donkey with a snotty nose or a horse with a high temperature, I'm more likely to think of strangles. If I happen to be in India in a working equid situation, then perhaps my suspicion should be slightly higher of a rather nasty disease. If it's the time of year when there's large movements of equines, so there can be large movements of equines across India through markets and fairs, for example, that would be another triggering factor. And perhaps there's been reports of the disease in other animals, so other species can also pick up glanders. And if we know that it's around in that area, we might have a higher suspicion that it could be that disease. It is unusual, but I think it's fair to comment that glanders is a zoonotic disease. It is seen, and it's even been considered as a form of bioterrorism. So it's very tightly controlled as a bacteria in the laboratory. Fortunately, it's very rare, but it is spread through cuts and scratches on human skin. So if you're working with suspect cases, it would be really sensible to be wearing gloves, latex, plastic, and wash hands well. Cover any wounds with sticky plasters. Can also, unfortunately, be spread through aerosols. So that means breathing any of the discharges that the horse is making. If you breathe them into yourself, you're at risk. So typically the people who would be catching glanders would be abattoir workers, vets and horse handlers. But it is fortunately rarely documented in humans. But when it does occur, it can occur in a cutaneous or respiratory or a disseminated form that spreads throughout the body and can be quite hard to distinguish between a slightly less virulent form of pseudomallei, the Burkholderii pseudomallei form. So this will be tested in the lab. So the image just shows this rather non-specific granulating area in a human that's contracted glanders. It is a disease that can be found in other animals. So I say donkeys are considered very susceptible, mules and horses also susceptible. Camels can be affected by glanders, and reported cases of dogs getting glanders from eating infected horse meat are around. Rodents that are used in biomedical research tend to be hamsters and guinea pigs, because interestingly enough, mice and rats are actually not so susceptible, and clearly humans can have the disease. So obviously the disease is going to be spread through the numerous ways that the animal is discharging it. So initially we have this quite fetid pus, coughing, nasal discharge, plus we also have the skin wounds. So this means that the water troughs, the feed mangers, will get heavily infected with the disease in a group situation. Flies can spread it, your stable kit, the dust, the harnessing, the grooming kit. The disease can also be spread at mating, and it can also be spread from mare to foal. So it's going to be spread in a huge number of ways in most of the sort of working equine and in high performance yards, unless they know that it's there. And what's perhaps even more alarming is the fact there is a carrier state in glanders. So we can have these latent bacteria that live in the nodules that they've created in the lungs, the liver and the spleen. There may be some degree of immune control, but then if their animals are stressed, they then spread and share the disease. And I think it's interesting that this aspect of the disease was known about for a very long time ago. And certainly the image shows a kind of design of a water trough to prevent glanders disease spreading, whereby although many horses can come to the water, each individual water feeder, water supplier is separated from the others. In terms of the slightly different equid species, donkeys and mules are more likely to get acute death and disease and therefore not become carriers. But the horses can mount a slightly stronger immune response and are more likely to produce a carrier status. And the carrier status can occur for a very long time, which means it can become really hard to then eradicate the disease. So in the environment, we think that the only reservoir is actually the equid host, and the bacteria should be quite easily killed by heat and dryness. So hot sun and hot temperatures and bleach and most proprietary disinfectants will kill the Glanders bacteria. But in moist or cool or dark conditions, the bacteria can survive many weeks. So we've had it even documented for up to sort of over 3 months at sort of temperatures of 15 degrees. And in just general moist conditions up to 6 weeks. So this is a problem in terms of the sort of the season of the year where animals are getting it, and the stable environment if we're trying to eradicate it. Because the disease is so virulent, so contagious and so devastating for both equine populations, the people that rely upon them, and the humans that could be infected, governments don't normally permit treatment of glanders. There have been cases where antibiotics can be used, but they tend to be extremely high doses for a long period of time and encourage the development of latency. There is currently no vaccine for either humans or equines available to prevent the spread of glanders. So what would normally be recommended is euthanasia on welfare grounds and euthanasia on zoonotic grounds. So the welfare grounds would be that the animal has developed ulcerated wounds, non-responsive pneumonia, and severe inflammatory respiratory disease. And obviously we don't want this disease to transmit to humans. So euthanasia is often the only treatment that is permitted. In humans, if they are unfortunate enough to catch a disease, they have to have intense intravenous antibiotics with third generation ceftazimidine and or carbapenems, orally perhaps for up to 3 to 12 months. And if that's not available in less cost-effective places, you might have to use something like trimethoprim or doxycycline. Even with treatment, the fatality rate can be up to 40 to 50%. And without treatment, this is a disease with a 90 to 95% fatality rate. So I think we're going to switch back in a minute now to Dr. Shivani, who is going to go on to talk about the zoonotic and health importance in her own communities.
Thank you, Dr. Alex. And as Dr. Alex mentioned, Glanders has zoonotic potential, and hence it becomes a public health concern issue. Humans can contract the disease and become infected through direct contact with infected animals, contaminated secretions, exposure of mucous membranes to infected material, and inhalation via aerosols. Veterinarians, animal handlers, lab personnel, and all the people working closely with equids are at a high risk. Although, as Dr. Alex told earlier, human glanders cases are extremely rare, but if it occurs, it has a 95% mortality without treatment and 45 to 50% with treatment. And hence, glanders serve as a great example of one health issue where animal health, human health, environmental factors are closely interconnected. Along with the National Referral Lab (NRL) and ICAR, National Research mm, National Research Center for Equine in Hisar, there are two other labs that are linked to public health surveillance. That is Integrated Disease Surveillance Programs (IDSP) and the National Center for Disease Control (NCDC). Glanders is a notifiable disease under Prevention and Control of Infectious and Contagious Diseases in Animals Act 2009. To streamline and to strengthen the control efforts, the Government of India has developed a National Action Plan for Control and Eradication of Glanders, and this National Action Plan was revised in 2025. The framework outlines the strategies for surveillance, diagnosis, quarantine, and disease containment. When a case is confirmed, strict measures such as quarantine of the animal, quarantining and isolating the premises, testing of the in contact animals, culling of the infected ones are to be implemented without any delay. The state veterinary authority and the union territory veterinary authority provides compensation to the owners of the glanders infected equine, and according to the policy, the horse owners are eligible for a compensation of 50,000, 30,000 for mule, and 20,000 rupees for a donkey. Since there's no treatment regime, lack of vaccination, and the zoonotic nature of disease, the control policy for glanders is to test, track, and destroy. Because of non-specific clinical signs in the early stages, lab confirmation is essential. There are designated labs for glanders screening and testing at different levels. So there are regional disease diagnostic labs, central disease diagnostic, and state diagnostic labs at the state level for screening of the suspected cases. And the confirmation of the screened cases is done at the National Referral Lab (NRL), which is headed by ICAR NRCE. Complement fixation test or CFT is usually the first screening test used, and repeat testing with recombinant ELISA and bacterial genome isolation to confirm are done at the National Referral Lab. Immediate isolation of the suspected animal to prevent contact with any healthy equids is essential. Upon confirmation, the standard approach is euthanasia. Premises equipment stable is to be thoroughly disinfected. All the animals that were in contact with the infected case must be tested and monitored thoroughly, and quarantine measures and movement restriction is applied to prevent further spread and to contain the disease in the contain the disease. Next, please. Yeah. Now this was one horse that was attended by the WS team a few years ago, which was tested positive for glanders, and the images illustrate the classical skin lesions with nodules, pustules over the neck, and marked nasal discharge and respiratory distress. Upon confirmation, the horse was euthanized and was buried as per the SOPs laid by the government policies. Next, please. So, again, use of the PPE kit and proper disposal is important so as to contain the disease and to prevent its spread. Next. Okay. When a glanders outbreak occurs or is detected, a rapid and coordinated response is essential to prevent any further spread. State veterinary authorities notify the disease with intimation of quarantine of infected animals, of in contact animals, euthanasia of the positive cases, proper disposal of the carcass, disinfection of the infected premises, and enforcing zoo sanitary measures. The state veterinary authority demarcates geographically and administratively the notified area. The notified area would be a 2 kilometer radius around the nucleus or focus of infection or a possible epidemiological link to confirmed or suspected cases. Complete restriction to movement is imposed on equine and human persons in the notified area. 100% of animals in the notified area are to be screened within 3 weeks of incidence of the first case, and the tests are repeated twice within the next 2 months with samples taken 21 to 30 days apart. 25% equals are screened beyond the notified area up to 10 kilometers, thrice over a period of 6 months, and beyond 10 kilometers, the government authorities undertake a physical and serological surveillance based on the risk assessment and movement of the equids in that area. Next. Traditionally, Maline test was used as a screening method, but it is largely outdated as it has been replaced by much better lab based diagnostic tests that are available now. And currently, India is following a two-tier diagnostic approach. In the first tier, we do a screening that is using serological tests like CFT and hemolytic co-regulated ELISA, which is conducted at the state level labs. Once the animal is positive on the screening test, samples are retaken and sent to the national referral lab Hisar for confirmation. And in the national referral lab, techniques like Western blot for serology and PCR for detection of bacterial DNA are used for confirming. In addition to the lab testing, clinical exams and post outbreak surveillance are also important to monitor and contain the spread of infection and to identify any additional cases. Next. Effective control of glanders requires advanced planning and preparedness, especially in regions where working equids are common. So, availability of a proper isolation area to safely manage the suspected animals and prevent the contact of the suspected or the infected cases to with the healthy equids is essential. Following the biosecurity protocols and the SOPs laid down by the government clearly according to the National Action Plan at the time of crisis helps in containing the disease. Veterinarians, animal handlers need to be educated and communicated about disease recognition, reporting procedure, and outbreak response. And finally, being aware of the local diagnostic labs, the testing procedures that are available, and the legal regulations, so that the suspected cases can be reported and managed quickly and effectively. Proper planning to ensure that when a suspected case does occur, response measures are implemented in a rapid and effective way. Following disposal of a confirmed case, thorough disinfection of the environment is necessary. All the like removal of all the organic matter like manure, bedding, residual food, water is essential, and using appropriate disinfectants like bleach or 70% ethanol with a significant amount of contact time is again essential to ensure effective killing of the bacteria. Next, no. Disposal of infected animal is a critical step in controlling the disease. Standard recommendation is euthanasia, and which is followed by safe disposal of the carcass. Now, disposal of the carcass can either happen through incineration or burial. Incineration may not be always possible; it may not be always feasible to do so. So, deep burial becomes the most practical way to safely dispose of the carcass, and it is to be ensured that the carcass is bagged properly, is disinfected properly, and the pit in which the carcass is supposed to be buried is deep enough so as to not attract any wildlife. The burial site is away from the residential areas and areas where feral animals are less, so as to control and contain infection in those places. Many working equid owners depend on their animals for livelihood, and losing an animal means a major economic impact on the family. This, along with the emotional and religious sensitivities that occur in the society, make taking decisions like euthanasia a bit difficult, and hence education, communication with the owners at this stage becomes really important, so that they don't hesitate to report and they don't hesitate to cooperate. And again, the government compensation schemes and awareness programs also become extremely important with such existing societal norms. Next. Underreporting due to asymptomatic carriers and reluctance of owners to report is one of the major challenges that we are facing in controlling glanders. That, along with lack of awareness and knowledge gaps among owners and sometimes professionals regarding early recognition and reporting of disease, movement of equids across borders for trade, labor, tourism, etc., facilitates spread and makes control a bit difficult, and hence monitoring at such situation becomes important. Moving forward, strengthening national surveillance system, imposing training and awareness programs, and promoting better coordination between veterinary and public health sectors is essential. Our ultimate goal is complete eradication of glanders from the country through sustained surveillance, early detection, and coordinated controlled efforts. Next. International Coalition for Working Equids it's a platform that provides educational material and practical guidance focused on one health and welfare of working equids. It includes training resources, disease information sheets, field guidelines to help vets and organizations better understand diseases such as glanders and to improve the response strategies. They are valuable for field vets as it provides accessible information on disease recognition, biosecurity procedures, and outbreak management. Thank you.
Thank you so much, Dr. Shivani and Dr. Alex, for such a thorough and informative presentation. I certainly learned a lot. If anyone has any questions at all, please pop them into the chat and we'll do our very best to answer them. On the screen right now, we've got the QR codes for our WBS Academy website and our YouTube channel, which has links to the other webinars recordings that we've done, as well as other educational videos. So if you want to check that out, that would be wonderful. But please do comment your questions and we will get back to you. Thank you so much.